Hello there. In this video, I want to continue the CPT surgery changes series we have started. So stay tuned to part 4. If you are new here, welcome. And you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've transformed hundreds of students to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. Let's continue our discussion regarding the 2021 CPT coding changes. If you missed videos in this series, you can check them out here. Remember, all the annual changes are fair game for testing purposes on the current year exam. So today, let's take a look at the 50,000 series. But let me ask, are you interested in the health information profession, specifically medical coding? If yes, are you interested in getting medical coding education and training? And are you interested in information regarding PRN's online medical coding courses? Again, if the answer is yes, let me invite you to our next online live Q&A information session on Saturday, April 24th at 10 a.m. Eastern Standard Time. To register, see details in the description box and check this out. Are you confused about all the medical coding programs, but unsure what to ask? Do you want to make sure you get everything you need to learn medical coding and become certified? Well, join me on the last Saturday of every month at 10 a.m. Eastern Standard Time, where I will answer your burning questions regarding medical coding. Join our monthly medical coding course Q&A session. To join us, click the link to register. Can't wait to see you. The 50,000 series CPT codes include the urinary system, male genital system, female genital system, and maternity care and delivery. 2 codes have been added and 2 codes have been deleted. And of course, there are guideline revisions and additions. A parenthetical phrase guideline has been revised following code 50690. Code 50690 represents an injection procedure for visualization of ileal conduit and/or ureteropyelography, exclusive of radiologic service. The revised guidance includes instructions for reporting radiological supervision and interpretation. For retrograde injections, use code 77420, and for antegrade injections, use code 74425. More on 74425 when I discuss the radiology changes in a future video. Code 55880 has been added to report ablation of malignant prostate tissue, transrectal high-intensity focused ultrasound, or HIFU, including ultrasound guidance. Prior to this new code, the only way to report this procedure in the treatment of prostate cancer was to use an unlisted code. Keep in mind, the code descriptor states that ultrasound guidance is part of the code, so you should not report ultrasound guidance separately when reporting this procedure. Both of the deleted codes were due to changes in current clinical practice and low utilization. The first one is in the excision vagina section of the female genital system, code 57112, vaginectomy, complete removal of a vaginal wall and removal of paravaginal tissue, a radical vaginectomy with bilateral total pelvic lymphadenectomy, and para-aortic lymph node sampling has been deleted. Also, a parenthetical phrase guideline has been added to state code 57112 has been deleted. In the vagina and cervix uteri endoscopy section, 2 parenthetical phrase guidelines have been added due to the new code 57465 that I will introduce shortly. The guidance following codes 57421 and 57461 directs users to report 57465 for computer-aided mapping of the cervix uteri during colposcopy. Okay, let's talk about the new add-on code 57465. Here's a tip. Remember, add-on codes are the ones with the plus sign, and they must be added on to another code. They can never be used alone. 57465 has been created to report computer-aided mapping of cervix uteri during colposcopy. The computer-aided device used during colposcopy, described in this code, includes optical dynamic spectral imaging that helps with mapping any abdominal areas for localizing biopsy sites within the cervix. Again, the intended use of the computer-aided colposcopy is to aid in the biopsy of the cervix. A parenthetical phrase guideline has been added following code 57465, listing the appropriate services to add the code, including 2 vaginal colposcopy procedures and several cervical colposcopy procedures. The other deleted code, again due to changes in current clinical practice and load utilization, is in the excision corpus uteri subsection of the female genital system. It is 58293, vaginal hysterectomy for uterus greater than 250 grams with colpourethrocytopexy, with or without endoscopic control. Also, a parenthetical phrase guideline has been added to state code 58293 has been deleted. The general guidelines in maternity care and delivery and the parenthetical phrase guideline in the abortion section have been revised due to the new evaluation and management code changes. If you are not familiar or need a refresher, check out the videos of this series, and you can check them out here. I hope this information was helpful for you and you have found value in these updates. If so, please share this video link with your friends and others you know preparing for certification, or your colleagues that code in the surgery section, on your social media platforms, of course. You have learned about the new changes in the 50,000 surgery series in your CPT manual. You have also learned that changes in clinical practice can cause a code to disappear forever. You have also learned that these changes are fair game when sitting for your 2021 CPC or any coding exam. And lastly, you have learned that I am hosting our next live Q&A information session on April 24th at 10 a.m. Eastern Standard Time. You will get exclusive information on our coding course specials, and I'll answer your burning questions regarding our online medical coding course. Check out the link in the description box to register, and of course, it's free. Questions of the day. Did you hear the key tip that I gave earlier? And was this information helpful for you? Also, did you learn something that you can apply? Let me know your responses in the comments below. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. And if you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out.
Are you interested in medical coding but not sure where to start?
and scared of wasting time and resources? Let me help you with the right steps to become a certified, marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, hitting the subscribe button for more information, and the notification bell so you are informed every week when I upload new content. I love hearing from you. So let me know you were here by providing a comment or a question, or just saying hi. You can also give me a little love by sharing this video on your social media platforms. Let's stay connected and connect others. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and thanks for watching.